Guests we have in the Zoom room the PD Mayor, Jesse Alig, who is the new president of the Mayor's Council of Guam. And we also have Sinahanya Mayor Robert Hoffman, who is the vice president of the Mayor's Council of Guam. Good morning, gentlemen.
Good morning.
Congratulations.
Thank you. It is an honor.
When is the last time the PD Mayor was ever president of the Mayor's Council?
This is the first.
Wow.
Proud to be the first.
Congratulations.
And do you remember, Sabrina, Mayor's, once again, congratulations, Mayor Hoffman. Congratulations on your continued success. You know, your LinkedIn profile is just like, a cajillion miles long with all of your, accomplishments and, board memberships. But Bree, I remember when you and I went out to the Mayor's Council meeting when it was held up at the Digital Mayor's office, and the mayors were there, and we actually pitched the idea of
Yes.
working with them for the virtual Liberation Parade. And just seeing the way they were interacting with each other, I was like, I bet you, give it maybe like within 6 years, Mayor Alig will probably be the president of the Mayor's Council. So I just like to say I was the first one who called that. Congratulations, Mayor Alig.
Didn't even have to wait.
What did you wait?
Exactly.
You got to share.
Yeah, I got a cup of coffee from Sabrina made cupcakes.
Okay.
We'll be happy to share with you, certainly.
Okay.
So you got new leadership over there at the MCOG. You guys also kept Angel Sablon. When I saw the inauguration, I was like, he's retiring? And then not even 24 hours later, he was rehired. I thought that was interesting. Did you guys, why did he announce this retirement? I mean...
Well, his term was up.
I
see. Yeah, we went into executive session to discuss that, and the majority decided to move forward with, voting on his appointment. And so that's how that happened. Mm-hmm. So there was no need to do a job search because the body decided that.
Just to keep him. Yeah. And he said, this is my family. And he'd been there, gosh, for a long time anyway. So no need for transition. So let's talk about the priorities now with the 17th Mayor's Council of Guam, now that we have some new leaders in charge.
Well, I think for me, a personal goal really is, and like I mentioned to the rest of the mayors, is just kind of a fresh start, a fresh view. We've done things the same way with most of the mayors for many years now, and I just like in PD, I tried something a little different. It worked. So hopefully we could try something a little different with the council so that, we can work together a lot better. And our messaging is more clear to all the mayors, to the administration, and to the legislature. So I'm very hopeful for that.
Mm-hmm. So what are some of these fresh ideas, I guess, I think you said fresh ways yesterday in
right. So there's a lot of especially with our administrative office, there's many of them have been there for a while, and most of the mayors have also been in office for a while, and their staff as well. And a lot of times we wait for things to come our way in order for us to execute our projects, and there's just a lot of bureaucracy, I think, that's tied up at our admin office and throughout the other agencies. So hoping to look at making that a better process for all the mayors, because I know that's always been a big problem for them. And that's definitely number one. I'm sure Mayor Hoffman can talk about all the other issues, the multitude of issues that we have. But when it comes to our admin office and our district offices working better together to get the job done, like I've been saying, I think that's definitely top on my list, because it affects the bottom line, which is the people. It affects our service to the people. So either the mayor spends out of pocket or waits.
So are we looking at fresh faces then over at the admin?
No, not fresh faces.
Okay.
Not fresh faces at all. There, most of well, our admin office is definitely classified, and our district offices are unclassified. So, the unclassified worker, of course, can also be let go at any time. But not looking at fresh faces. But there just needs to always be a rejuvenation. Every once in a while, and a commitment to serve. And so, everyone that works with us should also have that. Should also have that. That degree of fervor, because it's we're elected to serve, so we should always look forward to that.
And one thing I think both of you had mentioned when you guys were interviewed was it's about moving forward, setting politics aside, and working for the people. And so I think Mr. Hoffman, you kind of touched on that as well.
Yes, and I've actually known a lot of the mayors outside of being a mayor, and I've actually personally known Mayor Alig for quite a long time too. So we come from the same generation. So a lot of things that he wants to implement, I'm all on board for. It's modernization. It's using technology to its finest in this, because a lot of the processes that happen either at GSA or at BBMR or at the agency level too is what causes a lot of these delays. And I never understood why, when some contracts are the exact same written contract, still gets reviewed the same way. The only thing that changes are the dates and the amount for a certain thing based on whatever, and it still goes under weeks and weeks and weeks of the same scrutiny. I'm like, just hold it up against the light. You're going to see the words match, and it's just the amount and the date changed. And so I fully agree with him about with the changes in that the processes that need to happen. We're always sharing the best practices. That's one thing I really enjoy about the Mayor's Council families, that we share best practices and we support each other. And we always say what's good for one village is always going to be good for another. And people often criticize that, there are too many mayors or there's too much government. But at this level, this is actually where the work gets done. They don't realize the work we do because they're either out of their job in the daytime and they come home and everything's kind of taken care of. So I really appreciate my colleagues in the push. I wish there were things that we didn't have to do, but for as long as I've been in office, there's things that we end up picking up shortfalls for a lot of the agencies. And so hopefully getting more manpower at the council level, then also at the agency level, where we can have active dog catchers and animal control to bring that, because that's one of the things that we're constantly bombarded with are those calls. And then the EPA collections. I mean, I'd love to see that we close those loops, and there's processes and ways and companies out there that can just take these things so that there's monetary value, so that we no longer have to go and map and go door to door collecting these things, and people can just say, oh, you need your washer picked up, just call this number. And so in some areas the private sector can really make up for that, and the government can easily work that out versus bombarding the mayor's office with some of the things there. But it's a joy to work with Mayor Alig, and I look forward to it. And like I said, we've known each other for quite some time, so we're from the same generation, so we appreciate each other.
Mm-hmm. You talked about these delays and all kinds of issues. The governor, though, she said in her speech during y'all's inauguration that I will pledge that our administration will work very closely with you. We will be right there with you. We will provide you with the resources and services you need to provide for our people. Have you guys worked on your list and sent it over to Adelup yet?
We have not worked on a list. I was just elected yesterday. We have our regular.
You didn't do it last night? You're supposed to do it last night. You're not supposed to do this anymore.
There needed to be a little break somewhere between Christmas, New Year, the inauguration, and the election. There needed to be a break, a little somewhere there. But that's definitely on the list. Working closely also with the legislature is very important, because like Mayor Hoffman said, and like I also mentioned to my colleagues, our colleagues, is that the statute enumerates our duties and responsibilities, and there's a whole bunch of other duties and responsibilities that are assumed of us, and so we take care of it. Like you mentioned, we pick up dead dogs. If you look at the statute, we're not supposed to pick up the dead dog, and there's just everything else. I think most most everyone sees that we do things or expect us to do things that's really not within our duties and responsibilities enumerated in GCA. And we never complain about it. We just get it done. And so that's definitely something that I want to work on. And I'm hoping we can together, get that straightened out so that we can receive the help that we need and the authority that we need to execute our jobs.
Mm-hmm. And I think this pandemic has really shown, the hard work that you guys have been doing, including your staff, truly stepping up. Everybody says that, when there's an emergency, who do you call first? You call the mayors. So just thank you just for everything you guys have done and continue to do. But I did want to ask about the vaccination of mayors. When we had spoke to Melissa Savaras months ago about vaccinations and where you guys stood in the line, she said that, you guys were in line, just maybe not in the right line. And so have you guys gotten any feedback whatsoever in terms of mayors or your staff getting vaccinated, considering the fact that you guys do, the food distribution, you guys are constantly interacting with your constituents?
So I know the governor and public health do have us on their list of, staff or employees that need to get tested, but I'm not sure what phase we're in. I just attended our first meeting yesterday, and I did not get that information. I don't know, Mayor Hoffman, would you know?
I know they consider us essential, but I know that they're following the CDC guidelines, because I believe even the governor and lieutenant governor haven't been vaccinated either. So I think they're going through these incremental guidelines. The concern that we had yesterday is, as public health announced the 60 and above, that there's almost 20,000 60-year-olds on this island, or 60 and above. So that's a massive logistics undertaking. And I was saying this line is going to be to the mall and to Dededo Church, just going into Ukudu. So hopefully we have enough vaccines, and hopefully, so I was asking last night, I said, maybe it's better to get the 60 to 75 that have comorbidities, that have had diabetes and cancer and heart disease, and get them, the vulnerable, first, then kind of go up the chain on the age group. So, but they are the vaccine experts there, but not for our staff has asked us. I know the staff has asked even Mayor Jesse about it. And so we understand, especially for the 75 and above, we were all fine with letting them get it first. And, as we kind of go into the different things, we understand the teachers need to be vaccinated. We understand the frontline workers, the firemen, the policemen, everybody who has high contact jobs. We do as well. But, we also were given some of the PPEs, and we were provided for. And so I particularly, knock on wood, we're doing okay. But, there's many people that us mayors, we want to make sure that others get availed themselves of that first, and then we will go ahead and get in line just like everybody else.
Right. But Mayor Hoffman, you mentioned the governor and lieutenant governor. They're not out there, feeding people. They're not out there, picking up dead dogs and things like that, interacting, the way you guys are interacting with the community. So just saying.
Well, can I just add something about the those of the that are receiving dialysis treatments? So they're, one of the things that we do know is that they're going to have access to the Moderna vaccine, right? So through the renal centers, they should be able to, hopefully that'll lessen the amount of 60 plus. I mean, those that are under dialysis, because I think we have a large population that undergo dialysis. Mm-hmm. So that's, it's a good thing that at least the renal centers will be able to, take care of their patients.
Right. There was something I think, Mayor Hoffman, you said yesterday, encouraging residents, I think it was homebound.
Yeah, so we were asked to send up the homebound list already. A lot of the mayors have been actively getting those information, putting in the maps, putting in the phone numbers, sending it up to public health. But one of the things that actually we were able to discover or hear about yesterday was a lot of the Manumco that got the vaccine a few days ago or a few weeks ago don't really want to get the second dose if they have to stand in line for hours at a time and wait there and do all that thing. So it's becoming a problem because their next appointments start January 18, 19, 20, 21. And so everybody that we talked to, they said they had a great experience. It was fine, but they will not go back for the second one if they have to go all the way up there. And so that's a concern I raised with public health yesterday, because a lot of them were saying dad was in a wheelchair for 2 hours, or mom stood in line for X amount of time, which logistically, I was saying, why can't we just do drive-through vaccinations? It would save a lot of the get down time. Just drive up, information, show your card that you're the one, inoculate them, have them wait in the car there, and then they can go off, versus them parking, getting down, walking, and then going through all these things. I mean, if it was good for testing, I'm sure that there can be an easier way to do this, or bring the vaccination to those 75 and above's clinics, and they can go to the clinics during their regular visits and get inoculated there, because they, a lot of them already see the doctor on a regular basis. And so it would be a lot easier to field the vaccinations to the clinics and just tell them, okay, these are the clinics that are going to be doing it, and get those nurses and doctors there, because that's the greatest generation. And it broke my heart to hear that yesterday, that they don't want to get the second one because of the logistics of it and not necessarily the vaccine.
So when public health reached out to you and you brought these concerns to public health, what did they say?
They said they'll bring it up to the vaccine council. So once I turned in the homebound list, that was the thing. I said, here's the list. And by the way, these are the concerns that my seniors had. So, we were able to track of 135 that we identified for Sinahanya, about 103 actually got the vaccination. So we're pretty happy about that. I have about 20 on our homebound list that have had that. Of the 20, 4 of them are not of the age, but have major comorbidities that they've already been homebound because of massive strokes, of different ailments. So their families are pleading. So we said, we'll just add them on the list, because they have caretakers and they're of that age. But, the oldest one, I think, that we were able to get vaccinated, I think, is 96 years old. So she's just, she's a trooper. And she even said, if nothing has killed me yet, so we'll see if Corona can do this. And she had a great outlook on life, but she was like, boy, I have, 2 world wars and, all these other things. And so she's, I believe she was probably around during the 1918 pandemic. So this is kind of her outlook on life. But she was one of those that, I can't stand there for this long, and I can't be. And I understand even the people who accompanied the seniors, especially, they have jobs, they're family members, and it's hard to take off work for that, when you unspecified amount of time. You think it's going to be a 15-20 minute process, and suddenly you're there for 2-3 hours saying, they're going to take care of mom, they're going to take care of dad easily. That's a priority for them. But for them also, it's it's not something they expected to be at that location.
Yeah, they didn't expect it, because they even
They didn't
admitted
bring
it.
food.
Yeah,
Yeah.
which is kind
Food,
of
water.
interesting, considering the fact that the director of public health was the head of the senior citizens division for years. I mean, how could you not anticipate that? But
So I hope they work the logistics out. I know they called the disaster service workers up to help assist up there, and the mayors have always been there and willing to assist. It surprised us that they don't want a pre-registration list, so we were like, okay, good luck on this one.
mm-hmm. For the you said 20 on the homebound list, they were vaccinated. Public health went out there and vaccinated.
No,
they
no,
have not.
Yet.
No,
They
okay.
they asked us for maps and point of contacts, and one of the key information they want to know is if they were under any kind of home health care service, privatized nurse or something, that
Yep.
they can actually give the nurse the vaccine, and the nurse would administer it, since they're already there ministering to the person who's homebound. And what we saw is only 2 out of all of them had actual in homebound service in terms of a professional nurse. Other people just paid people on the side to watch them, like an aunt or a sibling or a cousin or something. And so they had somebody watching them, but not necessarily a healthcare professional. So we're a small village. I can imagine the larger villages, and we're an aging population, same along with PD, same with Assen. Our residents have been there for generations on time. So we understand that, and like I said, for a small village, just even our 60 to 74-year-old yesterday, when we pulled our listings and did our numbers, we were at 450. I can imagine the morning Jigo and Deredos. I'm like, if I'm 450, we're going to have 20,000 people up there. And then just for my seniors that are 75 and above, I have 130 still alive. That's war survivors. So that's a, it's going to be a difficult challenge for public health. And I asked, do we have enough vaccines? And no, we don't. So it's gonna be an interesting Thursday, Friday, Saturday.
What about in PD, Mayor Alig?
We have
What's been
for the
your
homebound.
response? Yeah.
We probably only have 5. I think we only have 5 homebound. And that's that list has gone in as well. The others have actually. There was about 60, I believe, that went in for the 75 plus, and even I think we had one that was 87 that actually walked in, and we didn't really have any problems in PD, thank God. But everything went well. The most people though are wanting the Moderna vaccine, and so that's for whatever it's worth, we're hoping that the clinics will offer we're hoping that public health will be giving the private clinics the Moderna vaccine so that they could administer the vaccine and separate that, because you can't mix the Moderna and the Pfizer. So if you've taken the Pfizer, you can't, right?
Do you guys have any estimate, I guess, just for the entire island, the Manumcos, how many are homebound over at the Mayor's Council?
I don't have any information on that. I'm sure that public health will have that by Friday.
Oh, so that's the deadline. That's the deadline to turn in the information.
Yeah, yeah.
Okay.
And so we encourage our people, if your family member's homebound that meets the 60 to 100, 60 to whatever age, please call your mayor's office and get on the homebound list, provide your address, provide the date of birth, provide the point of contact, so we can get those numbers out there, because that's the only way, because I feel for the crew that has to do this. I don't want to see them to double back. If they're going to go on Cruise Street and they're going to hit houses 1, 5, and 6, and then they go out to the next road, and then somebody calls on house number 7 saying, oh, my dad or my mom, and I'm like, oh, logistics wise, that's just going to be a constant loop. So, everybody, and I appreciate what KM's doing in helping us get the message out. So please, if you are homebound, comorbidity, 60 and above, call your mayor's office.
Okay. What's on the agenda?
I want to say though about the homebound and public health wanting to know if they receive services from Health Services of the Pacific. That's important to know, and the residents need to know that it's not for licensed nurses or any other. The government will hire a private contractor, and I think the private contractor is a Health Service of the Pacific. So they're just trying to correlate that information. So if you're already a client, you'd be able to receive the homebound vaccination through them. So that's the reason why, because I know that there are questions about any nurse being able to administer the homebound vaccine, and I don't think that's correct.
We did have a question here, and I don't know if you guys have heard. Will transportation be provided for our sinus in the next round? Have you guys heard anything about that? Because I know it wasn't provided in the first round. So
not that
we know of on it.
Okay.
We took some people up there, and then we were able to also have talk to the children or the family members of certain seniors and say, oh, by the way, your aunt's looking for a ride. She doesn't want to drive all the way up there, because she doesn't know the after effects of if she gets inoculated, she's going to be strong enough to drive back. So the family members were more than willing to, oh, how come auntie didn't call me, or uncle didn't call me? And it's just because it's a pride thing, but it's also letting them know that they were more than happy to do it, just to know that they're going to be safe and inoculated.
Okay. All right. What's the agenda, before we let you go, what's the agenda for today's meeting?
Well, we have our subcommittees that need to get tackled. The funeral escort issue, our user fees. So that's definitely on our agenda. The recycling revolving fund, our purchase orders, we still have not received them, but we're working on it, and that's one of the things we're talking about. So the junk cars are still out there, and everything else that needs to get picked up. So that's part of our agenda today.
All right. I think you said it. Get it done, right? Get it done. Thanks, guys. Appreciate it.
Thank you, too.
Congratulations.
Good morning.
Okay.
Adios.
Adios. All right. There you have the president of the Mayor's Council of Guam, Jesse Alig from PD, and the vice president of the MC.